Welcome to Project First Line, Infection Control Concepts and Actions for Healthcare Settings. In this module, we'll discuss personal protective equipment, better known as PPE, as it relates to our day-to-day work in healthcare. In this presentation, we will review standard precautions, personal protective equipment or PPE selection and use, appropriate donning and doffing of PPE, and we'll then finish with scenarios and key takeaways. What are standard precautions? Standard precautions are based on a risk assessment and make use of common sense practices and personal protective equipment. These basic practices apply to all patient care, regardless of the patient's suspected or known infectious status, and are in place to protect healthcare providers from infection and to prevent the spread of infection from patient to patient. Standard precautions are a first line of defense to keep germs from spreading. However, effectiveness of these practices depends on how well steps are consistently followed. As frontline healthcare workers, you should use standard precautions to care for all patients in all settings where care is delivered. These practices assumes any patient's blood or body fluid may be infectious. Proper selection and use of PPE, such as gowns and gloves, is one component of standard precautions, along with hand hygiene, environmental cleaning and disinfection, safe injection and medication handling practices, respiratory hygiene and cough etiquette, and properly handling, cleaning, and disinfecting patient care equipment and medical devices. This presentation will focus on appropriate PPE selection and use based on activities being performed. Let's review the goals of standard precautions and keep these in mind throughout this presentation and during our everyday practices as healthcare workers. The goals of standard precautions are to protect healthcare workers. Standard precautions ensure the safety and well-being of healthcare personnel by minimizing the risk of exposure to germs. They also protect patients. Standard precautions guard vulnerable patients from acquiring infections during encounters. And standard precautions prevent transmission by stopping the spread of germs between healthcare personnel, patients, and the environment. And standard precautions maintain a safe environment by reducing the number of microorganisms or germs in the surrounding environment. Before we dive into the details of PPE, we must first review hand hygiene or the cleaning of our hands. Cleaning your hands before putting on or donning PPE and immediately after PPE removal or doffing is an important infection control practice and should not be minimized. The Centers for Disease Control and Prevention, otherwise known as CDC, provides core infection prevention and control practices for safe care delivery in all healthcare settings recommendations. These recommendations include the following related to hand hygiene in healthcare settings. Healthcare personnel should use an alcohol-based hand rub or wash with soap and water for the following clinical indications. Immediately before touching a patient. Before performing an aseptic task such as placing an indwelling device or handling invasive medical devices. Before moving from work on a soiled body site to a clean body site on the same patient. After touching a patient or the patient's immediate environment. After contact with blood, body fluids, or contaminated surfaces. Immediately after glove removal. Healthcare facilities should require healthcare personnel to perform hand hygiene in accordance with CDC recommendations. Ensure that healthcare personnel perform hand hygiene with soap and water when hands are visibly soiled. Ensure that supplies necessary for adherence to hand hygiene are readily accessible in all areas where patient care is delivered. Unless hands are visibly soiled, an alcohol-based hand rub is preferred over soap and water in most clinical situations due to evidence of better compliance compared to soap and water. Hand rubs are generally less irritating to hands and, in the absence of a sink, are an effective method of cleaning hands. Hand washing should be considered instead of alcohol-based hand sanitizer when hands are visibly dirty, after known or suspected exposure to C. diff, after known or suspected exposure to patients with infectious diarrhea, with known or suspected norovirus outbreaks, and before eating and after using a restroom. Let's do a quick overview of the steps of alcohol-based hand rub or sanitizer hygiene. First, put on enough sanitizer on your hands to cover all surfaces. The efficacy of alcohol-based hand sanitizer depends on the volume applied to the hands. Rub your hands together until they feel dry. This should take around 20 seconds. Do not rinse or wipe off the hand sanitizer before it's dry. And do not use if hands are visibly soiled. Wash with soap and water instead. Technique matters when cleaning our hands. Let's do a quick overview of hand washing steps. First, wet the hands with clean, running water. Then, apply soap and rub your hands together vigorously for at least 15 seconds to create friction, which helps lift dirt and microbes from the skin. Cover all surfaces of the hands and fingers. Rinse your hands thoroughly with clean running water at a comfortable temperature. Last, dry with a disposable towel. Use the towel to turn off the faucet. Now that we've reviewed each of the standard precautions in hand hygiene, let's discuss PPE used in healthcare, and then we'll go into a little more detail about each, including appropriate donning and doffing. The selection of PPE is based on the nature of the patient interaction and the potential for exposure to infectious material. That is to say that the use of PPE is based on the staff interaction with patients and the potential for exposure to blood, body fluids, or pathogens. Healthcare workers should assess their risk for exposure to potentially infectious materials for each activity being performed and implement practices and PPE to prevent possible exposure. For example, gloves are worn when contact with blood, body fluids, mucous membranes, non-intact skin, or potentially contaminated surfaces or equipment are anticipated. PPE must be put on or donned, worn appropriately, and remain in place for the duration of work in potentially contaminated areas in order to be effective. PPE should not be adjusted, such as retying a gown or adjusting a respirator or face mask, during patient care. Appropriate PPE should be worn before coming into contact with the patient. Many times, this will be before entering the patient's room. PPE must be removed or doffed slowly and deliberately in a sequence that prevents self-contamination. Hand hygiene should be done before putting on PPE and immediately after PPE removal. We use PPE in healthcare for protection and prevention of germ spread. PPE includes gloves to protect the hands, gowns to protect the skin and clothing, face masks to protect mucous membranes of the mouth and nose, respirators to prevent inhalation of infectious material, goggles to protect the eyes, and face shields to protect mucous membranes of the face, mouth, nose, and eyes. We'll begin our PPE discussion with medical gloves. For healthcare professionals, our hands are our livelihood. It's important that we protect our hands and our health in order to protect the health of our patients. Remember, always clean your hands before putting on medical gloves. Wear medical gloves when anticipating contact with blood or body substances, mucous membranes, non-intact skin, an insertion point of a patient's invasive or indwelling device, certain medications and hazardous drugs, and equipment or surfaces that are contaminated or visibly soiled. You'll also want to make sure that your medical gloves fit properly for you to wear them comfortably during all patient care activities. Be aware that some people are allergic to the natural rubber latex used in some medical gloves. The FDA requires manufacturers to identify on the package labeling the materials used to make the medical gloves. If you or your patient is allergic to natural rubber latex, you should choose medical gloves made from other synthetic materials. Be aware that sharp objects can puncture medical gloves. Always change your medical gloves if they become damaged. Change gloves and perform hand hygiene during patient care if gloves become visibly soiled with blood or body fluids following a task, and when moving from work on a soiled body site to a clean body site on the same patient or resident. After removing medical gloves, clean your hands thoroughly with soap and water or an alcohol-based hand rub. Never reuse medical gloves. Never wash or disinfect medical gloves. Never share the same pair of medical gloves with other users. Do not touch your face when wearing medical gloves. Do not wear the same pair of gloves from one patient to another. Double gloving, or wearing two pairs of gloves at the same time, is not a part of routine care, and this practice is only used in very specific situations in healthcare. Double gloving is never used as a replacement for hand hygiene. Do not use gloves to access clean supplies. Do not touch common items with dirty gloves. Do not use alcohol-based hand rubs while wearing gloves. A few special considerations include: use hand lotions to prevent skin dryness. Consider using water-based lotions that are compatible with gloves during the workday. Lotions that contain petroleum or other oil emollients should only be used at the end of the workday because these types of lotions may affect the integrity of latex gloves and the efficacy of antimicrobial soaps or alcohol-based hand rubs used in your facility. Keep fingernails short, less than 1/4 of an inch long. Avoid artificial nails and nail polish as they can also increase the risk of germs and dirt accumulation. And avoid hand jewelry that may tear gloves. Some studies have shown that skin underneath rings contains more germs than comparable areas of skin under fingers without rings. Donning and doffing gloves. When donning gloves, select the correct type of glove and size. This is according to your hand size. Perform hand hygiene before putting on PPE. Extend the gloves to cover your wrists and over the gown if a gown is also worn. As part of the sequence of PPE donning, gloves are often the last item to be put on. When doffing gloves, keep in mind that the outside of gloves are contaminated. As part of the sequence of PPE doffing, gloves are usually the first item to be removed. If your hands get contaminated during glove removal, immediately clean your hands. There are a variety of ways to safely remove gloves. One option is, with the gloved hand, grasp the palm area of the other gloved hand and then peel off. Then, hold the removed glove in your gloved hand. Slide your fingers of the ungloved hand under the remaining glove at the wrist. Then, peel off and discard into the appropriate waste container. Remember, perform hand hygiene immediately after PPE doffing. Let's move on to gowns in the healthcare setting. Gowns. Wear a gown when contact between clothing or skin with a patient's blood or body substance is expected. For example, contact with a patient's non-intact skin, such as wounds. During procedures that are likely to generate a splash or spray of blood or body fluid. And when handling containers or patient fluids that are likely to leak, splash, or spill. Gowns provide an effective barrier between you and a patient's blood or body substances. They also protect your clothes from germs and protect others by keeping germs out of the environment when you remove and dispose of your gown properly. To make sure your gown is as effective as possible, you need to wear it appropriately and implement best practices for handling the gowns both before and after contamination. Let's review a few gown do's and don'ts. Do clean your hands before you put on your gown. Do ensure the gown is secured at the neck and waist if the gown design provides for this, as indicated by the manufacturer. Do not reuse the gown for the same or different patient. If it's a disposable gown, dispose of it properly before donning another one to see the same or different patient. If it's a reusable gown, ensure it is laundered properly before wearing it again. Put on a clean gown before seeing the same or different patient. Do not push or roll up the gown sleeves on your arms. Do not keep contaminated gowns lying around and ensure they are fully inserted into the disposal bin. It's important to try to not touch other surfaces with your gown. You could pick up germs and spread them without meaning to. Your gown should fit you well. If it's too big, it could get in your way and trip you, or the edges or sleeves could drag across surfaces and pick up germs. If it's too small, it won't cover you enough and you might not be able to move as easily, or it could rip or tear. Wearing more than one gown designed for PPE at once is not recommended. You're not any more protected from germs, and the extra layers can get in your way. Even if you change the top layer when it gets dirty, you could contaminate the bottom layer in the process and spread germs. Donning and doffing gowns. When donning gowns, perform hand hygiene before putting on PPE. Gowns should cover the torso, the legs to the knees, and the arms to the end of the wrists and wrap around the back. Slide gowns on with the opening at the back. Fasten around the back of the neck and the waist. When doffing gowns, remove the gown and clean your hands before leaving the patient's environment. Do not wear the same gown between patients. The gown front and sleeves are contaminated. If your hands get contaminated during gown removal, immediately clean your hands. Unfasten gown ties, taking care that sleeves do not contact your body when reaching for ties. Slowly pull away from the neck and shoulders, touching the inside of the gown only. Turn the gown inside out. Hold the removed gown away from your body, then fold or roll it into a bundle and discard. Again, perform hand hygiene immediately after PPE removal. When you remove and dispose of your gown properly, you keep germs from spreading into the environment. Face masks. This is the general term. For clarity, we will be referring to medical procedure masks, such as the one shown on this slide, when using the term face mask. Face masks. Wear when anticipating potential splashes or sprays of blood or body substances during patient care. As a reminder, medical procedure masks protect the nose and the mouth. Face masks are fluid resistant and provides the wearer protection against large droplets, splashes, or sprays of bodily or other hazardous fluids. They are loose-fitting and disposable. Leakage occurs around the edge of the mask when a user inhales. They also protect the patient from the wearer's respiratory emissions. A face mask does not provide the wearer with a reliable level of protection from inhaling smaller airborne particles and is not considered respiratory protection. Respirators, such as N95s, will be discussed shortly and are not the same as medical procedure masks. Let's review a few do's and don'ts of face mask use. Do clean your hands before you put on your face mask or respirator. Do put on your face mask so it fully covers your mouth and nose. Secure the elastic bands around your ears or secure the ties at the middle of your head and the base of your head. Do not wear your face mask under your nose or mouth. Do not allow a strap to hang down. Do not cross the straps. Do not touch or adjust your face mask. If you must touch your face mask, clean your hands before and after. Do not wear your face mask on your head. Do not wear your face mask around your neck. Do not wear your face mask around your arm. Donning and doffing a face mask. When donning a face mask, perform hand hygiene immediately before donning PPE. For a face mask with ties that are meant to secure around the head, secure the ties or the elastic bands at the middle of the head and at the neck, or for face masks with ear straps, place the mask on the face, covering the mouth, nose, and chin, then secure the straps around the ears. Flexible bands should fit to the bridge of the nose. Face masks should fit snug to the face and below the chin. Wearing a medical procedure mask safely includes cleaning your hands before touching the mask, inspecting the mask for tears or holes, finding the top side where the metal piece or stiff edge is, ensure the colored side faces outwards, place the metal piece or stiff edge over your nose, cover your mouth, nose, and chin, adjust the mask to your face without leaving gaps on the sides, and avoid touching the mask while it is in use. When doffing a face mask, the front of the face mask is contaminated. Do not touch. If your hands get contaminated during face mask removal, immediately clean your hands. Grasp the bottom ties or elastics of the face mask, then the ones at the top, and remove without touching the front. Or, for the face mask with ear straps, remove the straps from behind the ears without touching the front of the mask. Keep the mask away from you and surfaces while removing it. Discard in an appropriate waste container. Then, perform hand hygiene immediately after PPE removal. Respirators. Types of air purifying respirators used in healthcare. In healthcare, we use respirators when we think we're going to be in a situation where we could breathe in air that's carrying infectious material, like particles containing viruses. Respirators prevent the inhalation of infectious material. Respirators used in healthcare are known as air purifying respirators, or APRs. They work by removing gases, vapors, aerosols, which includes airborne droplets and solid particles, or a combination of contaminants from the air through the use of filters, cartridges, or canisters. These respirators do not supply oxygen from other than the working atmosphere. The appropriate respirator for a particular situation will depend on the environment and the contaminants. Types of air purifying respirators used in healthcare include elastomeric respirators. Half and full face piece elastomeric respirators are shown in the top two pictures. They are reusable devices with replaceable canisters, cartridges, or filters that can easily be changed. The face piece is made of rubber or silicone that forms a tight seal against the user's face. Therefore, fit testing is required. The elastomeric full face piece respirator has a clear plastic lens that covers the face and provides eye protection. The full face piece covers roughly from the hairline to below the chin. When cleaning and sanitizing a respirator, the manufacturer's guidelines should always be followed. Check the manufacturer's website if guidance is not included with the packaging of the respirator. If guidance is not available, OSHA provides general cleaning and sanitizing guidelines. Next are filtering facepiece respirators, commonly referred to as N95s. A National Institute for Occupational Safety and Health, or NIOSH-approved N95, is the most common type of filtering facepiece respirator used in healthcare, and is the white mask with yellow straps shown in the bottom left picture. Filtering facepiece respirators, such as N95s, remove particles from the inhaled airstream of the wearer before the air reaches the mouth, nose, and lungs. Most N95s are also good at blocking respiratory droplets from spreading to others, including any germs that you are breathing out. N95s are not the same as medical face masks discussed on the previous slides. They are also sometimes called disposable respirators because the entire respirator is discarded when it becomes unsuitable for further use due to hygiene, excessive resistance, or physical damage. NIOSH only approves respirators that pass its strict quality assurance and performance requirements. As part of these tests, NIOSH uses a near worst-case penetrating aerosol size. N95 respirators must not allow more than 5% of these particles to penetrate through. This ensures that every respirator that passes these tests will filter potentially hazardous particles as expected when used in real-world situations. Filtering facepiece respirators are divided into classes based on their filtration capabilities. N95 is a term referring to the N95 filter class, which removes at least 95% of airborne particles. The filtering facepiece respirator classes include N, which means not resistant to oil. The filtering facepiece respirator, or N95, that is pictured above would fall into this classification. N indicates it is not resistant to oil, and the 95 indicates that the filter removes at least 95% of airborne particles. R means somewhat resistant to oil, and P means strongly resistant to oil or oil-proof. These classes and oil-resistant designations are applicable to all types of air purifying respirators, which are available at 95, 99, and 100 filtration efficiency levels. Filtering facepiece respirators provide protection against particles, but not gases or vapors, and should not be used for respiratory protection to protect against hazardous gases or vapors. Filtering facepiece respirators form a tight seal against the user's face, covering the nose and mouth. As the user inhales air through the facepiece, particulate material collects on the fibrous material of the filter, which removes the particulate contaminant from the airstream. A filtering facepiece respirator may have an exhalation valve located on the filter, which reduces breathing resistance during exhalation. Because the effectiveness of this type of respirator relies upon the breathing air traveling through the filter, a tight seal to the user's face is very important. Therefore, the OSHA 1910-134 document discusses the major requirements of OSHA's Respiratory Protection Standard. The Respiratory Protection Standard requires the employer to develop and implement a written respiratory protection program with required worksite-specific procedures and elements for required respirator use. This standard requires an annual respirator fit test to ensure that users receive the expected level of protection by minimizing any leakage of unfiltered contaminant through gaps between the face and facepiece. More information about the OSHA Respiratory Protection Program requirements can be found at the end of this presentation in the Resources section. A user seal check is required each and every time the respirator is put on. We will review this process shortly. Next are powered air purifying respirators, or PAPR. A loose-fitting hood PAPR is shown in the bottom right picture on this slide. PAPRs are battery-powered devices that use a blower to pull air through the attached filters for particles or cartridges for gases or vapors to clean it before delivering it to the breathing zone of the wearer. High-efficiency filters are the only class of particulate filters available for powered air purifying respirators. The benefits of PAPRs include a low breathing resistance with a high level of protection. PAPRs can be used to protect against gases, vapors, or particles if equipped with the appropriate cartridge, canister, or filter. PAPRs are generally more protective than non-powered half-mask respirators because the blower creates positive pressure inside the facepiece under most work conditions, which reduces inward leakage of potentially contaminated air. A PAPR may have a tight-fitting half or full facepiece or a loose-fitting facepiece, hood, or helmet. The loose-fitting PAPR does not require fit testing. Loose-fitting PAPRs may be an alternative for users who have facial hair or are otherwise not able to pass a fit test with a tight-fitting respirator. However, OSHA does require fit testing for a tight-fitting PAPR. It's also important to note that most long-term care facilities had no need for respirators before the COVID-19 pandemic because any patient with airborne infectious diseases were transferred and cared for in appropriate and capable alternate facilities. Moving forward, however, respirators and the compliance obligations that come with them are now part of the expected infection control and employee safety programs in most long-term care facilities. Importantly, OSHA has an entire standard devoted to respirators, the Respiratory Protection Standard 1910-134. Considerations for respirator selection in healthcare. We've just reviewed the types of air purifying respirators used in healthcare, which was a lot of information. This chart may help you compare the various types of respirators side by side. As you can see from the chart, the N95 filtering facepiece respirator, the loose-fitting powered air purifying respirator, or PAPR, and the elastomeric half and full facepiece respirators each complies with the OSHA 1910-134 standard that we've briefly discussed on the previous slide. Use of these respirators also requires hazard evaluation and proper use training. Additionally, the tight-fitting N95 filtering facepiece respirator and the tight-fitting elastomeric respirators require fit testing prior to use to ensure proper tight seal against the user's face. The loose-fitting PAPR does not require fit testing. However, OSHA does require fit testing for a tight-fitting PAPR. A loose-fitting PAPR and elastomeric respirators can be used for high-risk aerosol-generating procedures. The Centers for Disease Control and Prevention recommendations for application of standard precautions for the care of all patients in all healthcare settings states the following. During procedures and patient care activities likely to generate splashes or sprays of blood, body fluids, secretions, especially suctioning, endotracheal intubation, and during aerosol-generating procedures on patients with suspected or proven infections transmitted by respiratory aerosols, wear a fit-tested N95 or higher respirator in addition to gloves, gown, and face and eye protection. A loose-fitting PAPR is the only air-purifying respirator that can be used with facial hair. A loose-fitting PAPR and elastomeric respirators are designed for reuse. N95 filtering facepiece respirators are not designed for reuse. They are disposable respirators because the entire respirator is discarded when it becomes unsuitable for further use due to hygiene, excessive resistance, or physical damage. The N95 filtering facepiece respirator, the loose-fitting PAPR, and the elastomeric respirators can be used for airborne precautions. How to don your filtering facepiece respirator. For your filtering facepiece respirator to work as effectively as possible, you must wear it correctly. This includes the process of putting it on and taking it off. Respirators must form a seal to the face. Fit testing is the best way to confirm that a respirator fits you. Before donning, always use a new respirator. Perform hand hygiene immediately before donning PPE. Inspect your respirator. If it appears damaged, dirty, damp, or if the straps are stretched, do not use it. Replace it with a new one. Let's review donning step by step. Your respirator may look different than the one shown on the slide. If your respirator has two head straps, these basic donning instructions apply. Hold the respirator in your hand with the nosepiece bar or foam at your fingertips. Pull the top strap over your head, placing it near the crown and just above your ears. Then, pull the bottom strap over and place it at the back of your neck and below your ears. Make sure to lay the straps flat and that they are not twisted. Place your fingertips from both hands at the top of the nosepiece. Press down on both sides of the nosepiece bar to mold it to the shape of your nose. Perform a user seal check. Filtering facepiece respirator user seal check. A user seal check makes sure that you have a good seal every time you use your filtering facepiece respirator or N95 respirator. It is possible to put on a filtering facepiece respirator or N95 using the correct technique and still not have a good seal around the edges. For a good seal, your breath must pass through your respirator and not around its edges. Doing a user seal check every time you wear a respirator tells you if gaps exist between your respirator and your face, which would allow contaminated air in. A user seal check can be a positive or negative pressure check. The top image shows a positive user seal check. To check for gaps with a positive pressure user seal check, gently place your hands over the respirator, covering as much as possible, then breathe out. If you feel air leaking out from the edges, or if you are wearing glasses and they fog up, the respirator is not snug. Adjust the respirator and try again. The bottom image shows a negative user seal check. To check for gaps with a negative pressure user seal check, gently place your hands over the respirator. Breathe in sharply and use the bottoms of your hands to block the paths where air could enter the facepiece. If the respirator sealed tightly, the facepiece will slightly collapse under the negative pressure. If the facepiece does not collapse or you feel air leaking beneath, the respirator is not snug. Adjust the respirator and try again. Not every respirator can be checked using positive or negative pressure. Refer to the manufacturer's instructions for conducting a user seal check on any specific respirator. Problem solve a scenario. What if you detect a leak in your filtering facepiece respirator or N95 respirator? Use both hands to mold the metal nose strip to the bridge of your nose, starting from the top. Adjust the straps at the top and base of your head. If there is still a leak, you may need a new N95 respirator, a different size or model of N95 respirator, or a different type of respirator. Additional items to keep in mind. As we've discussed previously, fit testing is required to ensure a proper respirator fit. Find out more from the person in charge of your workplace respiratory protection program. Jewelry, glasses, and facial hair can cause gaps between your face and the edge of a filtering facepiece respirator. Your respirator will fit better if you are clean shaven. Gaps can also exist in the respirator if it is too big or too small. You can find manufacturer's instructions for your respirator model on the manufacturer's website. Filtering facepiece respirator, or N95, do's and don'ts. For your filtering facepiece respirator to work as effectively as possible, you must wear it correctly. This includes the process of putting it on, known as donning, and taking it off, known as doffing. Filtering facepiece respirators must form a seal to the face. Fit testing is the best way to confirm that a respirator fits you. The filtering facepiece respirator must fit snugly against the user's face to ensure that there are no gaps between the user's skin and respirator seal. The respirator filter must capture more than 95% of the particles from the air that passes through it. Here are some of the do's. If your N95 filtering facepiece respirator has a metal bar or a molded nose cushion, it should rest over the nose and not the chin area. Do make sure to lay the straps flat and that they are not twisted. Here are some of the don'ts. Do not cross the straps. Do not wear your N95 filtering facepiece respirator around your neck. Do not wear your respirator under your nose or mouth. Do not wear your respirator on the top of your head. Do not wear your respirator around your arm. Do not allow a strap to hang down. Both straps should lay flat behind your head. And do not touch or adjust your respirator after it is correctly in place and a user seal check has been completed. If you must touch your respirator, clean your hands before and after. Doffing your filtering facepiece respirator. Remember, do not touch the front of your filtering facepiece respirator as it may be contaminated. Remove by first pulling the bottom strap over the back of your head, followed by the top strap, all without touching the respirator. Discard the used respirator in a wastebasket. Perform hand hygiene immediately after PPE removal. We will now move on to review goggles and face shields. Eye and face protection. Wear when anticipating potential splashes or sprays of blood or body substances during patient care. Eye protection, either goggles or a face shield, is part of the PPE recommended for COVID-19. In addition to getting in the nose and mouth or being inhaled, the virus can get into the nose and throat through the tear ducts and cause infection. Respiratory droplets that carry virus can land on your eyes and travel from your eyes to reach the target zones of the nose, mouth, back of the throat, and lungs. Some viruses can also infect cells in the eye directly. As a reminder, face masks protect the nose and mouth. Goggles protect the eyes. Face shields protect the face, which includes the nose, mouth, and eyes. Personal eyeglasses and contact lenses are not considered adequate eye protection. Let's review eye protection do's and don'ts. Do clean your hands before you put on your face mask and eye protection. Do use appropriate eyewear for the task. Do not compromise on safety. We all sometimes rush through a task to get it completed. Skipping protective eyewear can lead to an injury that may really slow you down. Do not compromise on eye safety even if you think nothing will go wrong. Eye injuries can happen in an instant. Do make sure protective eyewear fits. Protective eyewear should fit snugly around your eyes. It should also cover the entire eye area. Do not rub your eyes if you get an injury. If you do get an injury, even a minor one, such as a particle in your eye, do not rub it. Rubbing the eye may lead to a corneal scratch. To get dust or sand out of the eye, flush it with clean water. If you cannot remove the debris, seek professional care. Do wash hands frequently. Eye injuries are not the only danger at work. We are all surrounded every day by germs, such as viruses and bacteria. Make it a habit to wash your hands often to prevent getting or spreading an infection. It only takes a minute to wash your hands, but it can prevent eye infections. Do not ignore an injury. If you do injure your eyes at work, seek treatment. In some cases, it may be obvious that you have sustained an injury. If that is the case, you should get immediate emergency treatment. In other instances, an eye injury may seem minor, and you might decide to ignore it, but you should see your eye doctor just to be on the safe side. Do follow proper infection control practices. Workplace eye injuries do not only involve blunt force or flying debris. Pathogens such as blood and mucus can also get into the eyes, especially if you are a healthcare worker. Follow your healthcare facility's infection control protocols, including wearing appropriate personal protective equipment. Do take care of your eye protection. Clean, reusable eye protection frequently with appropriate cleaning product and by following product directions. Do replace eye protection when damaged. Do make sure that your eye protection does not get in the way and that you can see what you are doing. If your vision is blocked, you can be injured, and you might injure someone near you. Whatever is used to protect the eye should also allow you to see clearly and do your work safely. Donning and doffing goggles and face shield. When donning goggles and a face shield, remember to perform hand hygiene before donning any PPE. When donning, place over the face and eyes and adjust to fit. When doffing, remove from the back by lifting the headband over the earpiece. Then, place the items in a designated area for reprocessing or disposal. Remember, perform hand hygiene immediately after PPE removal. Safe PPE removal. The key for PPE removal is to limit opportunities for environmental and self-contamination. Keep in mind that the outside front of the PPE is the area that is most likely to be contaminated. Clean your hands after PPE removal. An example sequence of doffing PPE is as follows: gloves, face shield or goggles, gown, face mask or respirator, then clean your hands immediately after PPE removal. As we've learned, there are a variety of ways to safely remove PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious materials. Remove all PPE before exiting the patient room, except when wearing a respirator. Remove the respirator after leaving the patient room and closing the door. Enhanced barrier precautions. Enhanced barrier precautions are an infection control practice that employs targeted gown and glove use during high-contact resident care activities. Enhanced barrier precautions may be indicated for residents with any of the following: wounds or indwelling medical devices, regardless of MDRO colonization status, and infection or colonization with an MDRO. Standard precautions, which are a group of infection prevention practices, continue to apply to the care of all residents, regardless of suspected or confirmed infection or colonization status. Additionally, in the majority of situations, enhanced barrier precautions are to be continued for the duration of a resident's admission. Let's watch a short video about enhanced barrier precautions specific to nursing home settings.
As long-term care professionals, our jobs make a difference. It's not always easy. Each day can bring new challenges. But the effort we put in can be life-changing for someone's parent, grandparent, sibling, or partner. Threats to our residents' health are changing, and we must adapt to protect them. Multi-drug resistant organisms, or MDROs, are a known threat to nursing home residents. MDROs are resistant to multiple antibiotics or antifungals, meaning the drug has lost its effectiveness and cannot stop the germ. One way to protect our residents from getting hard-to-treat infections is to stop the spread of MDROs in our nursing home facilities. Unfortunately, many of these germs are often found in our facilities, on surfaces, and even on the hands of residents and staff. Residents can even have the resistant germ in or on their body without showing any signs or symptoms of active infection. This is a condition known as colonization. In fact, more than 50% of our nursing home residents may already be colonized with an MDRO. And because MDROs can spread undetected, we could unintentionally spread these germs when we provide high-contact resident care. This puts our residents at risk for colonization or a serious infection. Thankfully, enhanced barrier precautions are a way we can help reduce this risk. Enhanced barrier precautions, or EBP, are among many infection prevention and control practices that we should use when interacting with residents who are at higher risk of infection. We should use EBP for residents who have wounds, indwelling medical devices, such as central venous lines and urinary catheters, or those who have been colonized by or infected with an MDRO. However, if residents need to be on contact precautions, use those instead of EBP. So, how do we use enhanced barrier precautions? Much of the care that we provide for residents is close contact and hands-on, the type of care that is likely to spread MDROs. We should use EBP during the following resident care activities: dressing, bathing, transferring, changing linens, assisting with toileting, accessing indwelling medical devices, and providing wound care. So, before we enter a resident's room marked with an EBP sign, or before we engage in high-contact resident care activities, we need to gather all needed supplies and materials, clean our hands, and correctly put on a gown and gloves. Once we have completed our care, we need to safely remove and throw away our gown and gloves in the room, and clean our hands again before moving on to provide care for another resident. When we use these precautions for every resident who is at higher risk, we can help reduce or even stop the spread of MDROs. Enhanced barrier precautions may be new to many nursing home staff and will require each of us to use the mindset that, as soon as we encounter a resident with a wound, indwelling medical device, or MDRO, EBP should begin. By following this guidance, along with other important infection prevention and control practices, we can reduce the need for isolation, providing our residents with a better quality of life. This is a step in the right direction, balancing safety and quality of life while decreasing the spread of MDROs. Thank you for taking this step with us.
Now let's review two scenarios focusing on the appropriate personal protective equipment selection and use based on activities being performed in each scenario. Here is our first scenario. You are going into a standard precaution room where you will be performing a vitals check. Before stepping into the room, what are some things that you may need to ask yourself? Questions can include: when is hand hygiene needed? What type of PPE do I need to wear? Do I have the appropriate equipment for my task? Do I need to bring anything else into the room? Let's move on and think about steps to take while in the room. Let's take some time to think about what we need to know or ask ourselves as we obtain vital signs and interact with the patient or resident while in the room. Questions include: when is hand hygiene needed while in the room? Remember, hand hygiene should be performed before entering a room, before any aseptic procedure, after contact with bodily fluids, and after touching a patient or resident's surroundings. Other questions include: do I need to wear any PPE during my patient interaction? After completing the vital signs check, while we are still in the patient's room, we notice the patient has a urinal at the bedside which is half full of clear yellow urine. What standard precaution steps should we take before we handle the urinal? We would want to clean our hands and then don our gloves. Consider donning a gown. What standard precaution steps should we take after we handle the urinal? We would doff our gloves and clean our hands. We would then follow by doffing our gown, then gloves, and cleaning our hands. Let's move on and think about the steps to take before leaving the room. We have finished collecting vital signs and attending to the needs of our patient, and we are now ready to go on to the next area. Before leaving the room, what are some things to ask yourself? We may want to ask if other staff or managers need to be involved. For example, EVS may need to be notified of a spill. And are there any other potential risks in the room? A wet floor poses a slipping hazard. We also want to make sure that the call light is within reach of the patient, as well as the bedside table. Remember, we always want to clean our hands by either using an alcohol-based hand rub or sanitizer, or using soap and water hand washing. There are a number of things that might need to be done. Once you have finished your task, it's important to clean your hands before leaving the room to avoid spreading germs. Let's move on and look at another scenario. Here is our next scenario. You are going into a C. diff room to perform a routine patient care check-in. Remember, C. diff is a bacterium that causes diarrhea and colitis. C. diff is shed in feces. Any surface, device, or material, such as commodes, bathtubs, and electronic rectal thermometers, that becomes contaminated with feces could serve as a reservoir for C. diff spores. C. diff spores can also be transferred to patients via the hands of healthcare personnel who have touched a contaminated surface or item. C. diff infection can be life-threatening. As we go through this scenario, think about what PPE you would anticipate using to protect yourself and your clothing from potential C. diff contamination in this example. Let's discuss some things we need to think about and ask ourselves before going into a room with a precaution sign for a patient with C. diff. Questions and considerations include: Perform hand hygiene before donning any PPE. What type of precaution is being enforced, and what type of PPE do I need to wear? Consider the use of PPE as it relates to a C. diff diagnosis and any other tasks that may be performed while in the patient's room. Wear gloves and a gown as a precaution for contact with a patient with C. diff. Remember, hand sanitizer does not kill C. diff. Soap and water hand washing is needed after contact with a patient and/or their surroundings and after glove removal. Is a mask, goggles, or face shield needed for any of the activities that may be performed while in the patient's room? And what is the sequence for donning these items? The difference here is that you need to pay close attention to the PPE you should use to protect yourself and your clothing from potential C. diff contamination. Let's move on and think about the steps to take while we are in the room. Now that we are in the room, let's take some time to think about what we need to know or ask ourselves about infection control as we begin assisting our patient. Questions and considerations include: are there any potential risks in the room? If we need to change our gloves or gown for any reason while in the patient room, soap and water hand washing is necessary as hand sanitizer does not kill C. diff. We should also have some general awareness that surfaces that the patient has touched or used may be contaminated with C. diff spores. It's also important to know if the equipment is designated for this patient only or if disposable equipment is in use. Let's move on and think about the steps to take before leaving the room. We have finished assisting our patient and we're ready to move to a different area. But before leaving the room, what are some things you need to ask yourself? Questions can include: are there any potential risks in the room, and do other staff or managers need to be involved? Maybe the patient room requires trash to be picked up more frequently since we are disposing of gowns and gloves each time we leave this room. We may need to notify EVS. Do you see any other infection risks? What is the sequence for doffing of PPE? The main thing to think about here are the proper steps and sequence for removing your PPE to prevent self-contamination and cleaning your hands with soap and water immediately after removing your PPE because hand sanitizer does not kill C. diff. Here are the key takeaways. Standard precautions are practices that reduce the spread of germs and are used with any patient, regardless of known or suspected infection status. Personal protective equipment, or PPE, is selected based on the nature of the patient interaction and anticipated exposure to blood, bodily fluids, or other infectious materials. PPE must be put on or donned, worn properly, and remain in place for the duration of work in potentially contaminated areas in order to be effective. And cleaning your hands before putting on or donning PPE and immediately after PPE removal or doffing is an important infection control practice and should not be minimized. You can keep exploring these topics on your own using the resources found on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.